Welcome to the detailed English explanation of Lesson 7, Unit 14, Symptoms and Signs. The original textbook page remains on the left throughout this video. A yellow highlight shows the exact sentence or phrase we are discussing. On the right, you will see the English wording, its Arabic translation from right to left, and a short language note. I will speak only English. The Arabic is for you to read, not to repeat after me. This lesson teaches medical English for describing a patient's problems. The central distinction is simple. A symptom is something the patient feels or reports. A sign is something the clinician can find, observe, or measure. We will then study the language of presentation, which means the reason a patient comes for medical care. Next, we will work through vocabulary for tiredness, malaise, appetite, weight, and bowel habits. Finally, we will complete every exercise on page 37 and turn ordinary patient language into a concise case report. As you listen, pause if you need time to read the Arabic translation. Notice both the everyday patient wording and the more formal wording used in clinical notes and reports. Section A is called Describing Problems. The first sentence says, "The problems which a patient reports to the doctor are called symptoms." In other words, symptoms are problems described by the patient. The Arabic meaning is displayed on screen. A patient may report pain or nausea. Pain means physical discomfort. Nausea is the feeling that you may vomit. Both are symptoms because the patient feels them and tells the doctor about them. The next sentence explains that signs are what the doctor finds when examining the patient. The word findings is another medical word for things discovered during an examination. Two examples are high blood pressure and a rapid pulse rate. These are signs because a clinician measures or observes them. This distinction matters in a report. Do not call a blood pressure measurement a symptom. The page then says that symptoms are also known as complaints. In medical English, a complaint is a health problem reported by the patient, not an administrative complaint. Look at the first speech bubble. Mr. Farnsworth was admitted complaining of chest pain. Was admitted means that he was taken into hospital. Complaining of means reporting or suffering from. Chest pain means pain in the chest. In clinical notes, the abbreviation C/O means complains of. Therefore, C/O chest pain means complains of chest pain. Read the Arabic translation on screen and practice this useful short form. Now look at Section B, Presentation. In everyday English, a patient may say, "I went to see the doctor." In formal medical English, we say, "The patient presented." Here, presented is the past tense medical verb for coming to a doctor or clinic. The paragraph explains that the symptom which causes a patient to visit a doctor is called the presenting symptom, the presenting complaint, or simply the presentation. Presenting means the main problem at the time of arrival. Symptom means a problem felt or reported by the patient. Complaint is another word for symptom. Presentation is the noun for the way, reason, or clinical picture with which a patient comes for care. In the box, his presenting symptom was chest pain means that chest pain was the main reason for his visit. His presenting complaint was chest pain has exactly the same meaning. The next example is he presented to his GP with chest pain. He means the patient. Presented means came for medical care. To his GP means to his general practitioner or family doctor. With chest pain means because of or accompanied by chest pain. The final bubble says the usual presentation is chest pain. Here, presentation is a noun. Remember the pattern. Use presented as a past verb in a case report, and use presentation as a noun after words such as usual or similar. Section C is called Talking About Symptoms. The table has 3 columns: symptom, meaning, and patients say. The first group of words describes low energy. Tiredness means being tired. Lethargy means lack of energy and a slow, inactive feeling. Fatigue means tiredness or exhaustion, and it is very common in medical reports. Lassitude means weakness, weariness, or lack of energy. It is more formal and less common in everyday patient speech. The shared meaning in this row is loss of energy. The first patient sentence is, "I feel tired all the time." Feel means experience. Tired means lacking energy. All the time means continuously or very often. The next sentence is, "I feel completely worn out." Completely means totally. Worn out means extremely tired or exhausted. The third sentence is, "Lately I've been feeling completely exhausted at the end of the day." Lately means recently. I have been feeling is a continuing form. It began in the recent past and continues now. Exhausted means extremely tired. At the end of the day means late in the day, after normal activities. In a formal report, the doctor may replace these longer patient sentences with the more precise medical term, fatigue. Check the Arabic translations of each word and sentence on the screen before moving on. The next row is malaise. Malaise means a general feeling of being unwell. It does not name one specific symptom. It describes a general sense that the person is not well. I feel unwell and I don't feel well have this meaning. I've been feeling off color for 2 days also means that the patient has felt unwell for 2 days. Off color is an everyday expression. It does not literally mean that the color has changed. I haven't been feeling myself for a week means that the person has not felt normal for a week. I've been out of sorts all day means that the person has felt uncomfortable, unwell, or not like their usual self. Next is anorexia, which means loss of appetite. My appetite is very poor means that the patient does not want much food. I've been off my food for days also means loss of appetite. Weight gain means an increase in weight. I've put on 8 kilos and I've gained 5 kilos, both describe weight gain. Weight loss means a decrease in weight. The sentence says, I'm not eating any less than usual, but I've lost a lot of weight recently. This is important clinical information. Constipation means hard, infrequent feces. Motions is a polite medical word for stools. I'm not very regular means that bowel movements are not regular. Finally, notice that feel can be used with hot, cold, nervous, anxious, dizzy, and weak. She said she felt dizzy is a useful past tense reporting pattern. We now move to page 37. Exercise 14.1 asks you to complete the table with words from section C and put a stress mark before the stressed syllable in each word. The table has a noun column and an adjective column. Exhaustion is the noun, meaning extreme tiredness. Exhausted is the adjective, meaning extremely tired. Fatigue is the noun, meaning tiredness or exhaustion. Fatigued is the adjective, meaning tired. Lethargy is the noun, meaning lack of energy. Lethargic is the adjective, meaning slow, inactive, or lacking energy. Tiredness is the noun, and tired is the adjective. This distinction is important. In a clinical report, you may write, the patient complained of fatigue, using the noun. In patient speech, you may hear, I feel tired, using the adjective after feel. Exercise 14.2 asks you to make word combinations by joining one item from each box. The correct combinations are complain of, off color, out of sorts, present with, put on, and worn out. Complain of means report a symptom. Off color means unwell. Out of sorts means not feeling normal. Present with means come to medical care because of a symptom. Put on usually means gain weight. Worn out means extremely tired. Learn these as fixed word combinations. We do not normally say complain with or present of. Exercise 14.3 asks you to complete the sentences with the correct form of the word present. Sentence 1 is, a 67-year-old man presented with a 9-month history of increasing shortness of breath. The answer is presented. It is a past tense verb because this case report describes a past clinical event. A 67-year-old man tells us the patient's age and sex. With a 9-month history means that the problem has lasted for 9 months. Increasing shortness of breath means that breathing difficulty has become worse over time. Sentence 2 is, the most common presentation is loss of consciousness. The answer is presentation. It is a noun after the adjective common and before the verb is. Loss of consciousness means fainting or becoming unconscious. Sentence 3 is, cranial arteritis may present as fever without any obvious causes. The answer is present with no ed. After may, we use the base form of a verb. Do not say may presented. Cranial arteritis is inflammation of arteries in the head. Present as means appear in the form of. Fever means high body temperature. Sentence 4 is, the patient usually presented with a severe sore throat. The answer is presented because the description is in the past. Usually means normally. Severe means serious or intense. Sore throat means pain or inflammation in the throat. Let us finish exercise 14.3. Sentence 5 is, the presenting symptoms in this patient could perhaps be due to renal failure. The answer is presenting. Here, presenting is an adjective describing symptoms. Could perhaps be due to means may possibly be caused by. Renal failure means kidney failure. Sentence 6 is, other conditions with a similar presentation include acute cholecystitis. The answer is presentation. It is a noun after similar. Conditions means illnesses or medical states. Include means contain as examples. Acute cholecystitis means sudden inflammation of the gallbladder. Sentence 7 is, reduced growth is an important presenting complaint of celiac disease. The answer is presenting. It is an adjective before complaint. Reduced growth means slower or poorer growth than expected. Celiac disease is a condition in which gluten causes damage in the small intestine. Sentence 8 is, 2 months following presentation, the patient was able to walk. The answer is presentation. It is a noun after following. Following means after. Was able to walk means could walk. Review the 4 forms carefully. Presented is a past tense verb. Present is the base verb after may. Presentation is a noun. Presenting is an adjective before symptom or complaint. The Arabic translations on screen show the meaning of each complete sentence, as well as the key medical term. Exercise 14.4 asks you to read the patient's description and then complete the case report. The patient says, I was well until a few months ago. This means that she had no problem before that time. In the beginning, I just felt off color and a bit tired. Off color means unwell, and a bit tired means slightly tired. But lately, I've been feeling completely worn out at the end of the day. This means severe tiredness at the end of daily activities. I'm not eating any more than usual, but I've put on 9 kilos in the last year. Put on 9 kilos means gained 9 kilograms. My motions are hard, and my hair has started to fall out. Hard motions point to constipation, and hair falling out is hair loss. The formal report begins, a 50-year-old housewife who had been well until 4 months previously. The first answer is complained of tiredness. The second answer is malaise. The third answer is had put on 9 kilograms. The fourth answer is presented to her GP. The fifth answer is was constipated. Notice how ordinary patient language becomes concise report language in the past tense. In the final over to you box, write a short report about the 60-year-old man. Not been myself suggests malaise. Completely worn out suggests fatigue. Off my food suggests anorexia. Lost 10 kilos suggests weight loss. Write in the past tense and use the medical terms. This completes the detailed explanation of every section and exercise in the lesson.